Alright guys, so today we'll be talking about our Module 4 assignment PowerPoint presentation that will need to be posted to YouTube for SATC 230, Drug Abuse in Industry. My name is Trey Johnson and I'm the one that made this. Today we'll be going over the 5 scheduled drugs and also alcohol and the side effects of them and symptoms to look for in and around the workplace. And first and foremost, to start it off is marijuana. Marijuana is usually the most common type of drug you will see. It's usually like I guess you could say, easiest to get, and most people use this if they use any types of drugs usually. And some marijuana effects are mental function effects, such as delayed decision making, which can be very dangerous around the workplace if a decision is made slowly, or maybe they're seeing it different of how they usually would see it if they were under a substance like such as marijuana. People that are on marijuana, their concentration is diminished easily and they have erratic cognitive function. Some physical indicators that you can look for in marijuana use are red eyes. Their speech will be slower. Distinctive odor on the clothing is very easy to smell. Chronic fatigue and lack of motion. Next is cocaine. And some physical indicators of cocaine use are runny or irritated nose, because usually people will snort cocaine, so it'll mess up their nose and may make it run or make it very irritated. Maybe they might keep scratching it or rubbing it. Their pupils will also be very dilated. Instead of red eyes like marijuana, cocaine makes your pupils very dilated, as you can see in that picture. And they have an overreaction to stimulus, so if you say you touch them, they might jump. If you just touch them with your fingertip, they might jump at you. So they are very exaggerated in their actions when something hits them. And unlike marijuana, in slow speech, this person may be overly talkative instead of not wanting to talk at all. This person might be overly talkative. Cocaine can also cause workers to deal with theft and also dealing cocaine around the workplace. This person will be isolated from their normal activities and also will have lapses in attention, which, as you know, can cause potential accidents. Next is amphetamines. Some physical signs of amphetamine use are dilated pupils, profuse sweating, panic, and rapid respiration. A common speech behavior from amphetamine use is that a person will be very talkative. And some workplace issues that amphetamines can cause is false sense of alertness, which causes carelessness that can lead to accidents. So these people that may be on amphetamines will get easily alerted by something and focus on something that may not even matter, and that causes your carefulness of your other surroundings to also go down simultaneously, which of course, especially down here in Louisiana and oil and gas industry, is very cause for disaster right there, because you have to be careful of your surroundings at all times with all the heavy machinery and things of that nature that we use down here, especially on oil rigs. Next, I'll be going over hallucinogens. And some physical indicators that someone may be on hallucinogens is that their pupils will also be very dilated. They will be profusely sweating. They get easily aggravated, and their heartbeat will usually be much higher than it's supposed to be. Some behavioral indicators that someone is on hallucinogens is that the person, as I said, will get easily aggravated, and they will get easily confused. They will also have not a good sense of balance. They will lose their balance easily and possibly even fall down. Hallucinogens are a lot less common in than previous years because in a workplace setting, especially down here, the severe disorientation, as I said, loss of balance, confused easily. No one can survive working like that in those conditions. So a lot of people, of course, smartly do not take them as much as they used to, I should say. Some heroin physical indicators is that their pupils will be dilated, and a person on heroin, their speech will be slurred. They will have usually a loss of coordination, also a loss of balance, mood changes, and vomiting. And last but not least is alcohol. Some physical indicators that someone may be under the influence of alcohol is the smell on it. Obviously, alcohol is very distinct, especially if they don't wash it off and off their breath. Some behavioral indicators is that the person will usually avoid people, have a staggering walk, like stumbling side to side, extreme lack of coordination, and over exaggerated behavior. And their speech patterns, if someone is under influence of alcohol, will most likely be slurred out and exaggerated. And that's it. That's the 5 scheduled drugs and alcohol and their side effects and symptoms to look for. Thank you.